Hello and welcome to the Preface of Housemanship Training. This preface is designed to address following topics: the introduction to housemanship as a whole, tagging and the shift system. We will also briefly discuss the salary, allowances and leaves. Importantly, also focusing on the assessment part, key performance indicators or sasaran kerja tahunan, procedure safety and infection control, and finally, safe prescribing. So what are we waiting for? Let's get started. According to the MMC Guidebook for House Officers, the noble aim of internship training is to provide you with an educationally sound experience that professionalizes new medical graduates not only with appropriate knowledge, skills, and experience, but above all, attitudes. So let's answer these basic questions. Who qualifies to do housemanship in Malaysia? Essentially, those who have MBBS or equivalent like MD from local universities or from overseas universities which are accredited by the Malaysian Medical Council or MMC. If they are not from an accredited university, they will be required to pass the Malaysian Qualifications Agency examination, or also known as the MQA exams. So where are housemanship trainings conducted in Malaysia? The trainings are run in hospitals with adequate specialists to assist in supervising and assessing the house officers whom are assigned to them. These are usually larger tertiary hospitals and some district hospitals with specialists. The hospital is used as a training center here. So when can the candidate begin the training? The candidate can begin his or her training upon completion of the induction program conducted by the Ministry of Health. Let's look at the structure of the internship training. So at the hospital level, the House Officer Implementation Committee will monitor your progress. Every house officer in training will undergo a total of 6 rotations throughout the 2-year training period. As a house officer, you will undertake 4 monthly compulsory postings in medicine, pediatrics, surgery, orthopedics, and obstetrics and gynecology, as well as one of the 4 elective postings which are emergency medicine, anesthesiology, primary care, and psychiatry. Each posting will provide you with the abundant experience in managing patients who exhibit the broad general principles of the discipline illnesses. And these include managing the cases, simple and common, acute and subacute as well as emergencies, and performing simple procedures under appropriate supervision. Take note that there should not be a gap of more than 4 months between postings, otherwise you may need to repeat the entire internship training. The total duration of each discipline should not exceed 12 months. The total duration of your internship training should not exceed 6 years. If you do not satisfactorily complete any or all of the internship training requirements within the stipulated period, your training shall be discontinued and you will not be eligible for full registration. Under the guidance and supervision of peer seniors, you are reasonably expected to have prime responsibilities for the episode of patient care during a period of hospital admission, and this includes taking or checking the detailed medical history and examination and ordering the coordinating investigations, as well as understanding the components of a handover, participating in ambulatory care, and performing simple procedures under appropriate supervision. To achieve proficiency and competency, you are expected to attend ward rounds and regular ward meetings. During the training, you will be assigned logbooks prescribed by the board. The logbook will provide vital evidence of diverse and balanced clinical activities and educational experiences. The logbook is to contain feedback on your performance and experience pertaining to each discipline. So the activities carried out should be recorded as and when is necessary in the logbook. The onus is on you to keep the logbook safely and to submit it to your supervisor for endorsement from time to time and not merely at the end of the posting. Let's look at the end of the rotation. So you will be formally evaluated, encompassing a viva session at the end of 4 months posting of each discipline. Upon receipt of a satisfactory report on the evaluation, the committee will allow you to proceed to the next discipline. However, if the report is unsatisfactory, the committee may decide or consider additional period of supervision as may deem fit. At the end of each posting, you should be able to take a comprehensive history, document the clinical history, elicit relevant physical examination, formulate a detailed management plan, write suitable progress reviews, facilitate patient management, perform and demonstrate competency in procedures, write a concise discharge summary, and demonstrate safe prescribing of medications. Next, we will quickly take a look at the tagging system. The tagging logbook is a separate logbook which will be handed to you as soon as you enter the departments. These are the important details you will be required to provide before you begin your journey. And they include your orientation name, IC number, your posting number, the date of joining the department, who your tagging supervisors are, the head of department, your supervising specialist, and the medical officers in charge. The tagging hours typically begin from 7 a.m. to 10 p.m. and tag calls begin at 5 p.m. to 8 a.m. For new first posting house officers that join the department, you first tag with a senior house officer for AM shift only. During the second week of tagging, you will start to follow night shift as well. After you have completed 2 weeks of tagging with a senior house officer, you will work independently as a morning shift house officer and will be doing tag calls with another senior house officer. After assessment by the ward specialist, you will start doing your night shift alone. And as for the second posters and above, you will start tagging for the first week and working as an independent AM shift house officer. Once you have been assessed by a ward specialist, you will start with the 1 to 2 tag calls, then followed by solo night shift. It is mandatory to fill up your tagging logbook appropriately and 5 discharge summaries, then get it signed by the ward medical officer or specialist during your tagging period. Taggers must collect and take bloods for all new cases during your tagging hours and present to the medical officer or specialist in charge during the office hours and during morning passovers for patients admitted during on-call hours. Let's take a look at the shift system. So the working hours in the shift system are divided into the AM shift and the PM shift. For the AM shift, it starts at 7 a.m. and ends at 5 p.m. And for the PM shift, it starts at 5 p.m. up to 8 a.m. the next day. Do allocate an overlap of 30 minutes to 1 hour for handovers to be done. We will be looking at handovers in detail in the upcoming lessons. But for now, be familiar with the House Officer Handbook. The House Officer Handbook must be utilized properly to hand over important details regarding patients. As for the off days, there will be 1 day off every week for each house officer. However, sometimes the arrangement may be subjected to the availability if there's enough or sufficient manpower in the wards. Usually, the ward captain will be in charge of organizing the off days for the house officers, ensuring each of them receive the rest days as planned. As there is no restriction to the number of days of leave during the internship training stipulated in the Act, the Council concurs with the period of leave granted by the Ministry of Health, which is not more than 10 days for each posting. The rules and regulations pertaining to the leave, which has been specified in the Government General Order, must be adhered to. Flexi pay allowance, retirement savings, as well as occupational injuries and workplace accident benefits are also provided. Please be reminded to inform your supervisors and ward specialists as well as ward captains in the event of an emergency planned leave or medical leave. All planned leaves must be informed to your supervisor at least 2 weeks in advance. The leave forms must be signed by your supervisor before handing it to the admin department for planned leaves and emergency leaves. Next are the assessments. Let's start off with the multiple choice questions or MCQs. MCQs are scheduled around the 6th week of your rotation. The questions are based on core and essential CME topics. There are a total of 60 questions with 42 as the passing mark. You will receive a warning letter if failed at 2 attempts at the MCQs. If failed 3 attempts, you will be extended in the department. Next is case-based discussion, which is a tool used to assess the clinical decision-making capabilities and the use of pharmaceutical knowledge in the care of your own patients. A mini clinical exam or mini CX evaluates the trainee on history taking, physical exams, communication skills, clinical judgment, professionalism, and the ability to organize and provide an overall clinical care for the patient. Next would be logbooks. We will be reviewing this component in detail in the upcoming lessons, but for now, you need to know that the logbook is the most important book you will be holding on to throughout your training, as it serves as the documentation of your workplace-based assessments and learning. Ensure to hand in the completed logbook to the admin after it has been checked by your medical officer and supervisor, 2 weeks before the last day in the rotation. Failing which, you will be extended for 2 weeks or till you hand in your completed logbook. Next would be CMEs or continuing medical education. These presentations are imperative to have as a doctor at any level of training. This is one way to ensure that you always stay updated with best practices and fill in any existing knowledge gaps you have. Hence, it is encouraged to proactively participate in CME activities in your department, which usually takes place once a week. Attendance is compulsory for all the CME sessions. If you have not presented your part 1 month prior to the end of your posting, please inform your supervisor at least 2 weeks in advance to organize one as soon as possible. And finally, multi-source feedback or MSF, often referred to as a 360-degree feedback, is a method of assessment using questionnaires to evaluate a doctor's professional performance based on feedback from peers, patients, and also co-workers. Here, either a medical officer or specialist will be evaluating their experience working with you, as well as the ward nurse or sister will be providing their feedbacks too. Next would be key performance indicators or sasaran kerja tahunan. This is an example of how you can fill in your key performance indicators which is required every year. For example, let's take a look at patient history clocking and physical examination on admission, which you will be doing every day. For the quantity part, you can key in the number of patients clocked and examined. The quality aspect will look at the ability to clock and examine the patients thoroughly. And finally, the allocation of the time aspect for each patient will come under the time category. This is the same for your daily ward rounds, your daily rounds with your superior, and requesting urgent imaging studies, carrying out orders or planned by the managing team, and finally, drafting the discharge summaries and referral letters as per required in the logbooks. Next, let's take a look at procedure safety. This is a very fundamental concept that needs to be understood before beginning your training. This is to ensure that needle stick injuries can be avoided throughout your training. The first image here depicts the sharp bin. So here what we are trying to convey is sharps management. Ensure that you dispose of every sharp that's dealt with into the sharps bin appropriately. Once the sharp bin is full, close the cover and inform the ward sister in charge. The next image here is an example of a device that is used in safe phlebotomy. It is a butterfly needle with a safety cap, and that's attached to a vacutainer to ensure that the needles are not pricked into the rubber cap when transferring blood from the patient to the test tube. And the third image here is the personal protective equipment which you will need to don prior to reviewing a COVID-19 patient or a patient that has an airborne or droplet precaution. Next, let's take a quick look at blood and blood component transfusion. This is an important part in your training because you will be in charge on collecting the samples for group safe and whole or group cross-match, as well as picking up the ready bloods from the blood bank to be transfused to the patient. So importantly, you have to understand that the bloods are screened for transfusion transmitted infections as well as subjected to compatibility tests prior to the transfusion. Having this information will aid you in also getting the consent from the patient prior to transfusion. Always remember not to print out the GSH or GXM code in advance. The labels has to be printed immediately before the blood sample being drawn. And remember to always label the sample by the patient's bedside. This is to avoid errors or confusion. Some general principles of blood and blood products. So these are potentially infectious and need to be handled cautiously. Common organisms that can be transmitted through blood transfusion include hepatitis B virus, hepatitis C virus, HIV, and malarial parasites. Always remember that medications should not be added intravenously together with the blood or blood components that are being transfused to the patient. Blood and blood components should be kept in an appropriate blood box because the change in temperature can alter the components of the blood. Do not use leaking blood bag and immediately return it to the blood bank if you happen to find one. Ensure that the correct blood and blood components are given to the intended patient identification upon receiving. Insert intravenous lines using aseptic technique. Choose a site on an upper extremity which will minimize the patient's discomfort and restriction on movement. Label the date and time of onset of transfusion. And finally, monitor the patient's pulse rate, temperature, and blood pressure during the transfusion. Immediately stop the transfusion if there's any suspected adverse reactions. Great care should be exercised in prescribing medications. Prescription should be by generic name and written legibly to avoid errors. This is an example of safe prescribing. The name of the patient is stated, followed by the registration number and the IC number, the date of prescription, as well as the indication of prescription. This is one way of writing a prescription whereby the medication name is written in isolation of the routes, dose, frequency, and duration. Alternatively, you may write your prescription as so. The route of the administration, followed by the name of the drug, the dosage, the frequency, and finally, the duration. Next would be the Hospital Infection and Antibiotic Control Committee. So the Hospital Infection and Antibiotic Control Committee functions as a governance body to coordinate hospital activities in the prevention and control of healthcare-associated infections. They also help in promoting judicious use of antimicrobials and controlling the emergence of antimicrobial resistance, which is the new pandemic that we are facing now. This committee is also responsible in developing policies and procedures related to infection control, antimicrobial resistance, as well as antibiotics usage in the hospital. This amazing team is made up of the infectious diseases team, the clinical pharmacist, and the microbiologist team. This marks the end of the preface of the Housemanship training program. Thank you for your time.